Hello, and welcome to HCPCS Level II for beginners. My name is Madison Carter, and today I'm going to be covering a basic overview of the HCPCS manual for services and supplies coding, including how to properly look up codes within this manual. Now, while this presentation was designed with the physical book in mind, you may also use an ebook version if you prefer, or if that's all you have available. Please do have your HCPCS book handy. I'd like you to follow along in your book during the presentation, and you'll also need it for the hands-on practice at the end. So for today's objectives, we're going to talk about what is HCPCS Level 2, also simply known as HCPCS. We're going to talk about how to locate your guidelines, how to use this manual, and we're also going to do a brief code lookup practice together. The Healthcare Common Procedural Coding System was created by the Centers for Medicare and Medicaid Services, or CMS, and is currently maintained by CMS, Blue Cross Blue Shield, and the Health Insurance Association of America. The manual is used occasionally, depending on the type of office or facility you work for, and it contains codes for supplies like medical equipment and disposable items, drugs and vaccines, and some procedures billed to Medicare and Medicaid. Similar to the other two manuals, HCPCS is organized by an alphabetic index, a tabular list or numeric section, however you want to call it, I've heard it both ways, as well as appendices, and it also includes a table of drugs so that you can quickly search for the correct drug or medication supply code. This manual is really very similar to the CPT manual, and we use it in basically the same way. So if you haven't already watched my intro to CPT video, go check it out and come back here. The HCPCS book contains permanent codes that are updated once a year, as well as temporary codes that are updated as often as every quarter. If you work for a facility that uses a lot of HCPCS codes, you're going to need to stay up to date on those temporary code changes. Like CPT codes, HCPCS codes are also 5 characters long, but they all start with a letter, very similar to our ICD diagnosis codes. The letter is going to correspond to the section that that particular code belongs to, such as E codes for durable medical equipment. This is things like wheelchairs and crutches. Or you have your J codes, which are for all the non-oral drugs. All of the temporary codes live in sections G, K, Q, and S, and these may later be updated to permanent CPT codes. However, it's important to keep in mind that G codes are often reported in place of CPT codes for E&M and some other services when they're provided to Medicare patients, even though these codes are technically considered temporary by the HCPCS manual. If you need more help figuring out why we use G codes in place of CPT codes, check out my E&M Essentials series. Sections C, H, M, R, T, and U codes are special use codes that you may or may not use. It really depends on your employer. These are not often, if ever, asked about on any medical coding exams, so you don't need to spend time or attention on them. Instead, if you're prepping for an exam, you want to focus on permanent codes and your G codes. Now, HCPCS doesn't really have any guidelines or conventions like the other two manuals, so it's a little bit easier to use. In this case, you're just going to search in the index and you're going to find the code in the numeric section, and that's about it. There's not a whole lot of notes or guidelines that you need to follow. But if you want to refer to something, you can take a look at the National Correct Coding Initiative Policy Manual, specifically Chapter 12, if you feel that you need some additional guidance with HCPCS. I'll put a link to this policy manual in the description below, or in some copies of the HCPCS, I know the AAPC version has it, you can find Chapter 12 of that NCCI policy manual reprinted in the back of the HCPCS manual. It's in the appendices. So with that in mind, Let's look at the steps that you need to search for a code within the HCPCS manual. Step 1 is to read the documentation thoroughly and select your main term. Step 2 is to search the alphabetic index for your main term and subterm. Step 3 is to use the potential code or codes in the index, locate the code or codes in the numeric section. And step 4 is to read the code description or descriptions and determine which of those descriptors fits the documentation as closely as possible. Now, we can see that these steps are pretty much exactly like the steps that we used for code lookup in CPT, but in this case, our main terms are going to be things like supplies and equipment rather than procedures and services. Let's try an example. Following an eye procedure, the patient is provided with an eye patch to wear while their retina heals. Okay, so our patient had an eye procedure, but we're not reporting the eye procedure. We want to look in the HCPCS manual for the supply that the patient was given, which is what? Yes, an eye patch is the supply that the patient was given. Do you think you should look up by that main term, eye or patch? So both main terms are correct. If you search for eye, comma, patch, comma, occlusive is the subterm. If you search for patch, you're going to see patch, comma, eye with no subterm. Both entries in the index lead you to code A6412, which is the correct HCPCS code for an eye patch. Now, in addition to the alphabetic index, you're also going to need to know how to use the table of drugs and biologicals, which is in the back of the HCPCS manual. This is a complete alphabetic table of all drugs available with their corresponding codes. So go ahead and flip there now. On the first page, you can see that the description provides an abbreviation chart. What does the abbreviation in our example here on the slide, IM, mean? Right, it means intramuscular. So the delivery method is important to know as some drugs may have different codes for different formulations that are delivered using different methods. Now let's get back to our example here. The patient is given a 100 milligram IM push of Demerol. What is the correct HCPCS code based on this table of drugs and biologicals? So the entry in the table is for 100 milligrams of Demerol, which is what the patient was given, and this gives us three methods of delivery, both intravenous, intramuscular, and subcutaneous. Now, you don't have to have all methods used, just one out of that list. J2175 is the correct code, and you can verify that based on the code description in the numeric section. So I hope you found today's presentation helpful in getting you up and running with the HCPCS manual. This manual is pretty easy to use and it's really only briefly asked about on most core credential coding exams. So it's not something that I really go into a whole lot of depth on. Again, this manual is very, very simple to use. There's not a whole lot going on in the background as far as guidelines go. You're pretty much just looking up what you need, and there's one, maybe two codes out there that you can very easily compare the descriptions on. But before you go, check out these self-study tips. Try familiarizing yourself with the HCPCS manual by reviewing permanent code sections and your G codes. Also, try looking up random supplies, like just look up wheelchairs or foot orthotics and different medications within the drug and biological table. Good luck and happy coding!